Okay.
Thank you. So let me welcome our, I guess this is the third at Nourish at Home. I can't, I'm not counting very well. I called Wendy. I said, will you do it? She said, yes. And so grateful. I mean, all of this happened so quickly because people said yes. And so Wendy, I think most of you know Wendy. Wendy Sabin has been part of Shomrei for a very long time. I want to talk about Wendy for a minute because I met Wendy when I was president of Shomrei, maybe just before I was president, and we started to set up a nursery school. So in those days, Wendy was doing nursery school. And then Wendy moved on to help new mothers. And right? And to work with new parents on parenting skills. And Wendy has followed the journey of going from little ones to now senior citizens. And so Wendy now works with seniors. She's a social worker. She works with seniors. On my screen, Dawn is right next to her, and Dawn Berman now works with Wendy. So the two of them together really help figure out how to address the needs of senior citizens. And on a personal note, when we had a crisis in our family, I called Wendy and I said, hey, Wendy, what do we do? And so with that, I want to turn this over to Wendy. Wendy, it's all yours.
Oh.
And here's Wendy's presentation.
Oh, okay. So, Shirley and John, you'll guide me. So I wanted to thank you for inviting me, Shirley, and the gang over here. And I see Todd Wiesnick joined us, or Todd or Linda, or both of them. And
okay, wait, Wendy.
Yeah.
Everybody is mute except you, me, and Dawn. But before you start, let's say Mazel Tov to Todd and Linda because they're there. Because they just had a new baby.
Did they unmute us yet?
Yeah, we're unmuted. So Todd and Linda, Mazel Tov on the birth of your new granddaughter. They let a girl into that family. So anyway, now go on, Wendy.
Oh, okay. Oh, so there's 11 of us. So basically, Dawn
there's 17 of us, but keep going.
Oh, Dawn and I work together at Sabin Eldercare Solutions, and we're both social workers and geriatric care managers, or what's called aging life care professionals. And so in the midst of everything, building, when Shirley said, let's have a little conversation, I put together a few slides, and the first slide, calling it Dealing with the COVID Crisis and Our Aging Population. But it really doesn't need to be, this conversation is focused more on people that are retired or aging, be it aging in place, or people that are caring for elderly parents that are living somewhere else other than their home, I guess relatives or parents. And then the next slide is, I think John will go down. I guess that was just a little image that we had. There's nothing to say. You could go next. So some thoughts and ideas to explore. At the end of this conversation, I'd also like to add a little thing that I found on a website link that I'll share with you at the end. But so far, all of the calls that I'm getting during COVID, and Dawn, I'd like Dawn to, chime in if she ever wishes to during this talk, and then also Shirley will decide and say, if people have questions now or we wait till the end. But we could do, I'll pause in a few minutes, but some thoughts and ideas to explore, to have a plan. If any of you on this call, maybe some of you have been COVID positive or have had COVID tests and are either in recovery or your relatives and friends are, the important thing is to have a plan, to have possibly on one of the next slides, we talk about even having a pretend phone call with your doctor, with your internist. What would you do if you started to feel feverish or, loss of breath, like, feeling like you're shallow in your breath and, maybe just you start to feel like you have a cough or something. Having a plan is important. And I'll go into that more in the next slide. Um, Keeping your medications up to date and a month in your home for at least 1 month supply or more. Some of us get our medications through the mail. Some of them get us through walking into CVS. Some of them get CVS home delivery. I think it's just important now to have them all on a home delivery setup. And if you need help with that, a friend or family can help you with that. But I started to set up all my delivery on CVS like about a month or two ago. And one day when I tried to do it with CVS medication on the app, I almost had a nervous breakdown just ordering like 2 medications. So if you're anything like a normal person, I mean, ordering things on CVS app is not easy, but you can order regular medications and prescription medications.
Well, also, I'm just going to add quickly that your CVS pharmacist can do it for you. If you go in or you call, they'll check your insurance, Medicare, whatever your supplemental is, whoever's your Medicare provider, they will let you know if your provider will cover it, and they will do it for you. So it's really effortless.
Yeah, that's what happened, Dawn, for me that day. I had to get the pharmacist on the phone, and then she walked me through it. I couldn't. It ended up fine. So getting the home delivery set up during COVID, which is now and into the future, I would like to say that it is my suggestion. You can go to the next slide, John, too. It is my suggestion that that I'm not judging anyone for, it's really 55 and over, and I'm 55. I think Dawn and I are similar age, but whether you're,
I'm right up there behind you.
Yeah, so 55 and over, and I'm not trying to say do this, do that, should you do this, should you do that, but trying to stay out of the stores as much as possible on a frequent basis for your medicines and things like that, be it prescription and over the counter. So the medical plans and contacts, I made a note about what doctor would you call if you thought you had COVID, and do a practice run. Call your doctor's office, see if they're open, and see how they're seeing patients. What would they do? What would it look like to be like a telehealth medical conversation over the phone? Don't wait till you actually feel sick or have an emergency. Do a pretend phone call, because you might find out that your doctor is not answering the phone, or that there's a long wait, or, I think it's good to be informed, and it's good to have that little practice. So I actually did that myself the first week of COVID, because I had a really bad cough for 2 weeks, and I probably had it, but I don't know if I did. But I did call my doctor's office, and they told me like what to do. What hospital would you go to if you had a 911 emergency? Would you go to St. Barnabas, Mountainside, St. Joe's? Ask your doctor what they would advise, so that you're prepared if, God forbid, you do have to go to the hospital, and it's not during doctor's hours, if it's like at night or early in the morning. And I think that we could go to the next slide. I don't know if people are muted or not muted, or I'm not sure, Shirley.
Everybody's muted until we start the Q&A.
Okay, so we'll go back to that about the hospitals, because I don't have any. It's not my strict, strong opinion about which hospital is better than the others, but some hospitals have more COVID cases than others, and some hospitals are known for trauma, more than others. So we can talk about that later.
I can also just share for a moment. You might want to have a preemptive conversation with your doctor now and ask those questions while there's not an emergency, because that's really not when you want to have to start asking those questions. And GPs, general practitioners, and cardiologists and local docs have opinions, and they understand what are the COVID loads in all the hospitals, and they may be able to tell you, if that happens, go wherever.
Right, be prepared, and so I think that's right. What Dawn
and
said.
Share that information with your family or friends.
Yes,
before you have an emergency.
So I think that, yeah.
Let me just pause for a second. For those of you who will have questions, or if you're having questions as Wendy is talking, Wendy and Dawn are talking, there's the little chat symbol. Click on it and put your question in there. I'll be sure to pick it up if I don't see you after when the slides aren't there. Okay.
Okay. Guys. And then we could write down questions too, if you have at the end. Senior resources in our town. I wrote your town, and I just used the Montclair, Essex County town. Every town has these senior resources. Everybody has websites and hotlines, and every town so far, and be it my town, my father's town is Chatham, They have a free shopping and delivery for every senior in the entire township and town of Chatham. And so I was at my dad's the other day and we talked about that. So they're doing that in Chatham. So we should be aware of what they're doing. This is the Essex County Senior Aging Life Care. These are Montclair, these little slides have some information about what's going on in our town. So that's something to be aware of. And if you don't ask, you can't get. So if people, even I don't know at Shomrei if they're doing it because I haven't needed it, but I'm sure there's volunteers shopping at Shomrei and other synagogues and also other, senior resources in our town. We can go to the next page about food, meals, and resources. Basically, staying in touch with loved ones. These are basic things, but plan and prepare. Be open to helping from, getting help from others. Don't reject the help and the kindness. By saying, my mother-in-law knows this. She keeps saying, I'm okay, I'm okay. We know she's okay, but when people from her synagogue and her neighborhood want to go get her food, she usually gets 3 things instead of 10. So my whole thought about that is just get a little more than you need. Just get a little more so that way you can add it to your freezer. I think that for some reason, John, I don't know why that went away. Now it's back. Oh, okay. So try and be open to getting the help. It's all temporary. I think that it's going to last a little longer than we wanted it to, but I'd rather people be safe and, not have to run around to all the markets unnecessarily. Inquire about free services, and cooking and baking for others is a way to give back. So I thought of that in terms of people. Some people need the food, some people want the food, some people don't need it, but maybe enjoy cooking or baking and sharing it with others, be it in your neighborhood or your community. And we can go to the next slide. I think we're going to put that, Todd is here, and we're going to put that on pause till, I think Shirley mentioned, Todd is going to have a talk about some legal financial affairs, getting your affairs in order for another Nourish talk. But some of the basics I had, I'm just going to go over this. That you can see the notes I have, and Todd will be more in depth about this, getting your legal affairs in order. I have a mother-in-law who's wonderful. My father-in-law is he's 86 or 87. He's in a nursing home. And she first this week just said she couldn't, where's our will? She couldn't find it. And she said, where is our power of attorney? Which is not correct now. So now he's been in the nursing home for 4 years. And so the reason why I'm bringing it up is because not only is it personal, but it's true. And it's something that we have to tackle and be prepared for. Do you have a will? Is it up to date? Do you have it up to date in the last 10 years? Do you have a power of attorney? Do you have these papers at home or these papers at the bank? Do you have copies of them? Have you shared them with a family member or a close friend? And that's something I think that's important. And again, you can join on for another talk about that. The other thing I mentioned, do you have a list of your bank passwords printed and up to date? This is for any human being. It doesn't matter your age. But if you have a bank account and you have a insurance and you have credit cards and you have different things that have passwords, I have mine hidden in my, actually right, I think where it is. Yeah, right in my, I'm not going to tell you where it is in case you break it. It's hidden in my office somewhere. And I have to say that was not an easy list to get. I every couple of years I say, I need the list, because there's some emergencies that are happening, not during COVID, where you should always have this list. And I think it's good to have. And so I have that now and I feel better about it. The next slide talks about a PolST form, PolST. That's something that stands for Physician's Order for Life-Sustaining Treatment. That's, you can click on that link. And again, we'll share these slides with you. That's something to discuss with your medical doctor for yourself or for your loved one, and keeping things up to date. That's sort of like a DNR, do not resuscitate. So it's important to know what a PolST form is, both during COVID and not during COVID. This is absolutely, the last 2 slides is not specific to life in COVID right now. But that's something that speaks about what are your wishes if, God forbid, something happened to you and you were sick and you did have to get intubated. And sadly, there's a few of this on this phone call that have gone through this experience during COVID now, with, God forbid, sadly, deaths happening. And, we've been faced with this question. We've been asked this question. So we need to be prepared. The next slide talks about Medicare and Medicaid. And that is to understand during COVID right now, what are your now this is again, during COVID or not COVID, you should know your Medicare rights as a person who gets Medicare. But during COVID, I have had a lot of clients calling me and saying, well, I broke my hip. Now I'm in the hospital. Now I'm having surgery, but now we don't want to bring my mom or dad back to a subacute rehab. We want to bring them straight home because we're going to bypass the rehab. So we're going to do, it's almost like having a 1-month rehab at home instead of in a rehab center. What are the reasons why Dawn and I, as care managers, are being a little neurotic and a little overprotective of our parents and our friends, such as, are you going bike riding? Are you doing excessive things that are a little risky? Dawn had a friend today that someone got in a motorcycle accident.
Oh, no.
He's 76, by the way, just saying.
Yeah. So he's not a 25-year-old kid on a motorcycle. So these are the things we're talking about, is looking at your high risk activities during COVID. You want to do what you can do not to end up with a huge cut and gash or broken leg or broken hip and heading right into the hospital. If that were to happen and you needed your Medicare services activated, they would do PT, OT, and everything at home. The issue is, if you have visitors coming into your home, they're coming in their PPE, which is the protective equipment and gowns and gloves and masks. And technically, we don't want a lot of these rehab people in our home. So that's one of the things. You can have it, but we that's what it looks like. It's covered by Medicare. So that's possibly part of our discussion. There's the Medicare therapy for mental health issues. That's important to know. Medicare provides that as well. If anyone on this phone call is feeling stressed out, worried, anxious, I got a call today from one of my relatives who is not on Medicare, but she said, I'm doing this, I'm doing that, I'm having a lot of anxiety. She's having like a lot of post-traumatic stress disorder issues that can be reawakened during COVID. And that is important, to listen to yourself and your body and ask for help. You call your primary care doctor and you say, I'd like the name and number of a psychiatrist or a therapist that will take Medicare. And, that's free.
And in COVID, we also have access to visiting therapists that will do telemedicine. So you don't have to go out. They don't have to come to you. They can do it on the telephone, and Medicare covers it.
Yeah. And so finding those Medicare providers is not always easy. Dawn and I can find them for you, or you find them through your general insurance plan by making a phone call or asking your doctor. Now we could go to the next slide about resources, I think it is, or yeah. So some of the things during COVID that are helping, a lot of my friends that are, be it at home a lot, be it retired, be it my father, who's a highly, active 85-year-old, is the different resources that you can get online. The JCC has an amazing resource program online with Zoom every day. And at the end of this talk, you can let me know if you're doing any of those. I did something with the Jewish Film Festival. Jewish Family Services of MetroWest has a tremendous amount of support groups and events that are happening for people at home. There's a link to on my website and here for the Aging Life Care Organization, which has a lot of resources and, how to reach out and how to find out, what we do. So that's a little bit about, the last slide will be the Zoom support groups. So I've been getting invited to Zoom support groups and Zoom cocktail hours and Zoom meetings, Zoom trainings every single day of my life during COVID. And I actually sign up for very few of them, but some of them I sign up for a little bit more fun. I did the Zoom groups. They have support groups for widows and widowers. They have support groups for people who have someone who was lost to COVID. They have different support groups for people that are stressed out. So like I said, the JCC, Jewish Family Services, I've seen those support groups on many of those websites. Chatham Senior Services has it. Like I'm sure there's many of them in Montclair even. there's a lot of topics that the one that I love, the Zoom activities from the JCC, I think are fantastic. Again, some of you are involved with other organizations too. Getting help to get onto Zoom, we could, talk about that, and finding, tech support. A lot of them have the tech support. The one thing at the end of another slide, just the one before this, it said, what is a GCM, or what is an aging life care professional? That is what I do. And so basically it's a social worker or a nurse that's called a care manager or an aging life care advisor. And that's what Dawn and I do. And we help people, whether they're doing pre-planning at home or whether they're having a crisis, which is very often, more the time than when people call us is during a crisis. But this call is more like a pre-planning, like a discussion time, so that we can get all of our ducks in a row. So I can open it up to chatting and talking a little more with Shirley, and John will make the slides available another day. But I'm sorry if I was rushing or talking too fast, but I just wanted to get the information out there.
Thank you. There was a lot of things that I think that we need to reinforce and then open up the questions. But I think, Wendy, Dawn, I think what you were emphasizing here is planning is key.
Very much so.
Don't wait till you get sick.
Very much
I think
so.
the other thing that you've been saying very clearly is let other people know what the plans are, where your medical records are, right? Because particularly if you're isolating at home, and this is a time not to be proud and a time to reach out for support.
Well, and people want to help. Lots of people are home and we feel out of control. So if we can pick up something when we're at the store, or drop by with a loaf of homemade bread, or have a chat once a week, that helps everybody, the giver and the givee.
I think that's
welcomed.
It's important to share that, because a lot of you know, and all of you on this call are either, whatever age you are, you're noticing, one of the things I'm noticing, and Dawn can share this too, is that the last few phone calls of people that called me are people calling me because their parents are so isolated and they're noticing some significant issue is happening with them. They're not going out. They might have had something mildly going on with their memory. And now all of a sudden, I have 2 crisis cases this happened to, where all of a sudden there was like a severe change. And a lot of that is because there's not a lot of stimulation going on for them mentally. And so if they had a very mild cognitive decline, it becomes, unfortunately during COVID, it could be critical and massive right away. It could almost become a crisis overnight. And then we have to do a few things. We have to get them some blood work done. We have to get them checked on the, telehealth with their doctor. We don't want to bring them to the doctor. They don't have to go to the doctor, but we have to activate a plan. So these are the things that we're seeing now. Often.
So, Wendy, I have a question for you, and then I will share a story with you. But Lynn Rubin said Lynn, I'll just read it for you, and you can unmute if you want to, but my 79-year-old mom has hurt her back. She did too much and activated a chronic condition. She has had good results from chiropractic care and acupuncture. Not an option now. Who can she call?
Well, that's a good question. Thank you for asking that. Again, everybody I think is doing a lot because they're either afraid to let relatives in the house, or they're avoiding, whether it's a handyman or a relative coming over. So that's, they need reminders, but they're not listening to those reminders. They're doing it all. And now that she has this injury, the issue is, what are you going to do? I know my husband just had an injury from running, and he just informed me that he's going to the physical therapist tomorrow or this week. And I was like, what the hell are you talking about? You're not going to a physical therapist tomorrow. Like, figure it out. And we were just half laughing. He goes, no, I called him. So that means he must be really injured from running. But he said they all wear PPE, and he's going, and he trusts them, and they're going to have a mask on, and he's going to have a mask on, and they're going to have gloves on and a gown on. And they're going to probably stand, I think, probably 6 feet away from him, and maybe showing him the exercises as opposed to touching his back or his hips so much. But in the case of your mother, I would say it's possibly something similar.
Well, and there's the risk benefit, Lynn, with anything. If she's having so much discomfort, maybe she can find an acupuncturist or use her acupuncturist and be the only one in the waiting room, the only one.
Are they closed now, though? I know they closed.
People are starting to open up, so
Okay.
that's where you
Okay.
kind of have to call. Otherwise,
Right.
if she's had any luck with physical therapy, she may also be able to find a physical therapist who individually will be able to come in to the home with PPE and maybe give her some other exercises, stretching, heat that may help her.
I think also in relation to what some people have been telling me, if it's that bad and someone really needs something like that, we also are hearing about people getting COVID tested before they're letting anyone like that into their home, like that the patient, your mother or someone is COVID negative, and that the practitioner is also can tell you that they've been tested recently, along with wearing the PPE. But I would shy away from really letting people into the house. I mean, if she can get out somewhere locally for like a one-time treatment, possibly. But it's very tricky. I mean, and I don't say do this and don't do that, but it's very tricky. And the doctor's offices are opening up again.
Well, that's the risk benefit, because also being in pain continually is also not
Yeah, well,
great for your
she's kind
community.
of constantly in pain, but I think now it's my understanding from my father, she wouldn't talk tonight. So that's another sign it's bad. I think she's literally laid in bed, like
Yeah.
not able to get out of the bed at this point.
I think that's a call to the general practitioner. And
I would call it, yeah.
Okay.
Yeah.
How do you find the chat? I can't find it.
Okay, who is that?
Oh, that's
Josie.
Josie.
Let's
I see the questions. in the
Josie, there's a little icon up at the top that has like a little bubble.
That's okay, Josie. Just ask your question.
Well, I just wondered if you're aware of this group in Montclair called Umbrella. Ann Lapel's been active.
yes,
Yeah, I heard of it.
They charge a modest fee, but they've been terrific.
yeah, I think some other Shomrei members maybe have tried that recently.
It sounds like it's a great service. It's like they will come to you, in terms of fixing thing or helping you in the
Well,
home.
they go grocery shopping, which is
right.
a big help because I don't drive.
Oh, they do that too for you.
Yeah. Oh, yeah. That's mostly what most seniors are doing with them now,
Mhm.
is getting them to do groceries.
Very beneficial, and money well spent.
Yeah. I don't know if anybody else had a question about any of, are you finding one of the things, and back to Lynn, what you were saying, and it's also, if you hear about whether it's your loved one or a friend or a family member that's physically laying in bed and really can't move a lot, that's an example of what could lead to a problem of inactivity. And one of the things I want to say is it's so important for all of you on this call to remain active every day, whether it's walking,
And hydrated.
you're walking, stretching, hydrating. Dawn told me today, which I'm going to get, but I don't want to get it, but about that it's good to have that. You could talk about that, Dawn, a little bit. That
I'm going to make an Antidotal mini commercial for older individuals, and I'm not a doctor, but a pulse oximeter. You know, when you go to the doctor, you're in the hospital, and it's that little machine they put on your finger, and they tell what your.
I have it here. I'm holding it up, but I don't think you could see it.
Yeah, you can get them for about $25, $30 at your local pharmacy or online on Amazon. They'll deliver it to your door. Anecdotally, and I've been in touch with lots of visiting nurse services and lots of doctors that are doing community visits and stuff lately because of my mother-in-law and my father-in-law both being having COVID recently. She had passed away, unfortunately, from it, 79, 80 years old, and they were fine physically and medically prior to this. A lot of the older adults do not feel. Thank you, John. Do not feel some of the normal effects that you're hearing on the news, like a cough, like pressure in your chest, pain in your chest, shortness of breath. And if you spike a fever or have a low 100.5 fever, pop this little bad boy on your finger a couple times a day, and it should read somewhere between 95 and 100. And if it starts dropping, call your doctor and let him know. because it just seems like that number represents how well you're being oxygenated in your body. And you may not feel you being starved, your body and your organs being starved of the oxygen until you're very sick. And if you can look at that number and talk to your doctor and say, oh, that's not a good number for me. It's a really good diagnostic tool and you don't have to leave your house. And it's 30 bucks.
What's it called?
It's called an oximeter.
Oximeter.
And has your pulse on it and it has your blood oxygen level.
Yeah, wait,
And it's
Amy,
a good tool to have along with, an automatic blood pressure cuff and a thermometer.
I think that Dawn actually told me about it today. I had heard about it last week from another Shomrei friend, actually. And I was like, no, I'm not getting it. And then Dawn's like, no, you need that. You're getting it today. And
there it is. There's the picture.
And there's a good article in the New York Times about
that.
How older people are feeling different symptoms.
Oh.
My mother and father-in-law, neither of them they had one night of a fever of 102, then they went down 100.5, and they had no real other symptoms. They got tired and they didn't feel like eating, but other than that, no chest pain, no cough, no breathlessness, none of the stuff that you would attribute. And I had just happened to get one of these that was telling something was going on.
But
So
also,
again, it's anecdotal, but it's proven to been helpful to me as well as lots of people that I know right now that have family members that are older.
Yeah, the thing is to just support Dawn. What had happened was her mother-in-law didn't just come upon it. She was in the hospital, and that's where she got it when she had her hip fixed from a very sadly, minor hip surgery that she picked it up in the hospital. And then she came home and didn't know she had it and then infected her husband. So it's been very upsetting.
And in all fairness, this also happened at sort of the first week or so of
nobody knew.
April, where the hospitals were very, very overwhelmed with COVID. And I think that is clearing up to some degree, but you want to, again, I think what Shirley and Wendy had reiterated is have your plan now, know what it is, get the stupid little stuff around, share it with your family and friends so they know who your doctor is. They know who your, what medication you get, who your pharmacy is, what friend lives close enough that they can run over and see you. If somebody needs to say, hey, I can't get a hold of my mom or dad, I want to say hi. Can you knock on their door? Just like simple little things.
See, that wouldn't work where I live in a senior building. People wouldn't want to come in.
Well, they don't have to come in, but they can knock and say, Josie, you there?
Well, they have to come into my building to do that. I'm saying I live in a building with 120 apartments of seniors.
Oh, right.
But are you going outside at all?
Yeah.
Yeah, good.
For walks.
Yeah.
But I think that on the phone, what Dawn is saying, just
call.
Have
follow up. What was the other thing this oximeter measures? Blood oxygen
and your pulse.
And pulse. Thank you.
And the other thing is I was saying too, preventatively, because I think it is alarming and upsetting, that we don't want to alarm and upset and scare people on the call, is that having the prevention and talking about fitness and doing the exercising and drinking water and keeping in touch with positive stimulation on the Zoom calls and, not all of the isolating kind of things that you're doing, but, getting out with masks, having your mask on, going for a walk in your community, and just
general well-being, keeping yourself in as good a shape as possible. Exercise is important because they want you to inflate your lungs.
Yeah.
Particularly with this. So if you have a balloon and you can blow into your balloon 5 times and inflate it 5 times a day, that helps. Go out for a walk. I mean, don't, jog and fall, but, try to be mindful of the deep breathing and do it.
And also be mindful of the free resources in your community. So, like, I know that umbrella sounds wonderful. I don't know if I think they might charge a fee, or I don't know.
They do. They charge $6 and then it went to $10.
Right. Well, that $6 is very, very, very $6 an hour.
No, $6 was the original fee to do your grocery
That's
shopping.
very, very reasonable.
Yeah, and then I guess they got overwhelmed, so they raised it to 10.
But so using your community, through Shomrei and through, neighbors or friends, and, tap into those resources. And the rabbi or, Lisa always knows that there's, teams of people behind the scenes that would help be it you or a friend that might be, another congregant.
Yeah, most of my friends are staying out of stores.
Yeah.
I mean,
That's
another issue.
really quite good plan if you can manage that.
Did Shirley, were there any other questions? I see, what is that one little thing on?
I don't see any questions. I'm wondering, there's been a lot of talking about things you could do. How about some of you out there who have some things that are working for you, that's helping you in terms of feeling healthy, feeling engaged? Any? Carolyn?
Shirley, it's
Go ahead.
it's Rita.
Oh, Rita.
Oh, I thought it was Carolyn.
Go
Hi, Rita.
Okay. Hi. One of the things that my daughter, the nurse who's in an emergency room, has told me after I got my medical power of attorney done, is to carry it with you all the time.
Yes.
So just passing on that information.
That's a great
so-
idea. That's a great
Is it in
thought.
your cell phone, you're saying, Rita?
No, the actual with the medical power of attorney.
Right, no, but I
Rita,
was asking if you carry it in your cell phone or
Medical power.
she carries it in her bag.
Well, I have a flip phone, Wendy, so it doesn't carry anything other
okay, you
the
and my mother.
numbers I put in.
Melissa knows she's on this call.
Wendy, this is Carol. I can add to that because
Hi.
I'm alone. What I did when I redid my documents a couple of years ago, the person who gets to pull the plug and the person after that has a complete small binder with all my information, a copy of my
Great idea. Great.
a copy of the form originals, because the attorney thought I was crazy when I said I wanted 6 copies. My primary care has a copy. The hospital has a copy from when I had the because my surgery was at Hackensack, but it's in the Hackensack documents in their computer. Plus the fact when I did my power of attorney and my will and my healthcare directive, I made up binders for anybody who was mentioned in there. Plus the fact that I have a flash drive that I have all this information, passwords and everything. So it's not on my computer hard drive. It's on a flash drive. So my power of attorney, my executor doesn't have to take my CPU. They can just come in and they know where everything is. Plus
That's awesome.
Plus the fact
That's awesome.
that my power of attorney and my executor have keys to my home. And I'm sure there are things I have left out, but I also want to reiterate, when you talked about financial, one of the ongoing arguments I kept having with Joe is I happen to be the financial person in the family. Right. And I kept saying, if you don't learn this stuff, you can be taken to the cleaners. And I got on my soapbox almost, would you believe, almost 10 years ago, 9.5 years ago, that the non-financial spouse should learn this now and not have to find out afterwards.
Yep.
Just putting in my 2 cents.
That's good.
That's awesome. That's awesome advice.
I need Dawn.
Yep.
Dawn's the famous bookkeeper of her family.
Yep.
So
Yep.
I know Todd, I'm sure will enhance on that more so when he does his talk soon.
Power of attorney is a legal procedure. It's not just that you tell someone I want you to be in charge.
Josie, it's useless if you just tell someone, and Todd
You
will
have
tell
to
you.
have a
Todd's
legal
here.
one.
Todd, can you say,
here.
can you
Todd,
speak
say
to that for a
something.
second?
Give them a preview.
Yeah, a power of attorney is a written document, and it needs to be witnessed and notarized.
How would you do that now when nobody's going anywhere?
We figure out a way.
They could do it on the
done-
computer.
The witnesses can do it through a window, can do it through a doorway, as long as they can see you signing.
Huh?
Yeah, Todd, when is Todd's talk, Shirley? Next week?
2 weeks. 2 weeks.
2 weeks.
Great.
All right,
So
that's good because I think that, yeah, normal legal papers is one thing, but legal papers during COVID it sounds like you got to get creative.
But you have time on your hands.
Yeah.
So,
We've done them on the hoods of cars.
mhm.
That if you don't want to leave your house, the easiest thing is if you have a glass door or a window. If you're on the 6th floor, it's making it more difficult.
Hmm.
Yeah, but people are, with a mask, you could come down, God forbid, you
Come to the lobby.
come to the lobby, sign the papers, you use your own pen. That's another thing, everybody's going around getting back out into the world using their credit card or using a pen, or you just, before you go out and go to this store or that store, just be prepared. And that's just like a little safety thing, because, anything that you're doing involves touching of other things, getting gas, filling your
Right.
with gas.
oh,
That's cool.
I saw Carolyn's hand up before. Carolyn, did you want to add something?
Yeah. She's muted.
Can we unmute Carolyn? Carolyn,
Jump
you're
on yourself. We can't unmute people in Google.
Oh, right. I forgot.
What does she have to do?
Carolyn,
Can you hear me?
yes,
now
we
we-
Yes.
Oh, okay. That's okay. There are lots of exercise videos online for
Yes.
every type of thing you want to do,
Yeah.
whether it's chair yoga, Pilates. You can have a physical therapist who will tell you exercises. And I find it's much easier doing it, watching it online than relying on yourself to do it alone. So,
And it's more fun.
well, I don't know if it's more fun, but at least you have the satisfaction that you're doing the exercises that you normally might do, as I do when I go to the Y. So you can do it at home.
Carolyn, what is going on at the YMCA in Montclair? Are they doing any Zoom programming?
Some instructors are individually.
No, I mean like activities or anything special during COVID?
Is the Y doing anything?
Not that I know.
No. Well, many of these exercises are run by the Y,
Okay.
but I think it's the national Y, because
Oh.
they're instructors from California, from all over.
Are you
And
Carolyn, finding out are you doing anything, Carolyn, or anybody else here with the JCC in West Orange? They have a program every single day, 5 things to do a day. It's amazing.
That's good to know.
Oh God. And it's all free. It's all free. It's fabulous.
And so John is posting.
Pretty also.
Yeah.
John is posting the MetroWest activities.
I could get, if you want to email me, or Shirley will give you my email. They send me an email every single day. So
And it's free. That's great. Because what I've run into is why exercise teachers doing their classes on their own from home, and they're charging.
no, you don't have to pay for it.
Yeah, no.
Okay,
No,
good.
everything I'm doing is free. And Carolyn and others, every single day I'm doing some kind of exercise for free on whatever it's called, not Zoom, but just from the internet or Instagram. I do it every morning.
John is going to give us a link to this.
Yeah, we'll put the link when we put the slides up, and you'll see it in Shomrei Week. We will add the link, right, John?
Yeah, and I could also,
Yeah.
if Shirley or anyone emails me or Shirley, I can connect you to Gina Goldman. She's the JCC director, and she does all the activities every single day, and there's different ones every day.
I just put the link in the comments too.
Okay. John, will you take that down now so we can see the rest of the people?
Oh,
There we go. Thank you, John.
yeah. So that's great to do some of those.
I still don't have chat. What was I supposed to look for at the top?
John,
the JCC link.
at the top of your screen, usually to the right, there's a little thing that looks like a chat box, and right now there's a 1 in it. And if you
I
click
don't
on
have that.
I could just read it to you now, and you could write it down.
Okay.
It's you have your computer at home, right?
Yeah.
So it's jccmetrowest.org, and you
Yeah,
go
that's the main thing. Okay.
jccmetrowest.org, and then you
Right.
go in there, and then you click on probably the programs that they have in the day. That it's called the J is live now. The JCC.
The link to this has been in Shomrei Week for a few weeks. It's at the bottom for things in the area.
Oh, okay.
And you can call me, Josie, on my phone number, and I'll give it to you too.
Okay, who's that? Dawn?
Wendy.
Wendy.
And then you could call me at 201-665-4499. And anyone can call me or Dawn, and we'll direct you to any services that you need.
Okay. I wonder if you would comment on the fact that seniors are being told that even though things may be opening up in New Jersey, that we should still self-isolate or stay away from everything.
yes.
Sadly, that's true right now. I don't think maybe into at least through the next couple of weeks, especially until anything opens. Nothing is open yet. I mean, no businesses are really open yet. Everything's still curbside. I thought
Well,
the
some of the
governors
tennis
were
clubs
allowed-
opened, some outdoor activities, shooting, golf courses,
Yeah.
ranges, shooting ranges, stuff like that opened. And I think the rest are soon to follow. And I think that until we really start to open up more and see and there will be spikes and where they are, you're better off trying to minimize your contact with others.
I think that, and Josie, this is for anyone on the phone, like people are going outside with masks and talking to a friend from 6 feet, but obviously not inviting people into your apartment or your house, or, none of that's happening yet. Not for most of the people on this phone call, I don't think. Not at my house, at least.
Yeah, well, my daughter grounded me in early March. I haven't been anywhere.
Yeah. It's very upsetting. It's very upsetting.
So I'm going to, Josie, it's because she loves you. As my daughter said to me, I want you to be alive.
Yeah.
True.
We need to respect that.
Well, no, I think she was right.
Yeah. So there are some people we haven't heard from. We have time for maybe one more question, and then I will tell you what's happening next week. Any other questions?
I have a question. Why can't you hear me?
I see like I can hear you very, very softly, Toby, but I can see you sort of moving across as sort of an ethereal
I can't see Toby.
image.
Well, I have a question.
Okay, Toby, let's hear your question.
The question is this. Like everybody else who's on warfarin, you have to be tested every couple of weeks to see what your number is.
Right.
And Summit, in their glorious owning of this part of the world, decided that you can't go to their office. That's over 3 blocks from me. Someone came to me, a phlebotomist. The first words out of her mouth were, "That'll be $30. And that's every 2 weeks I have to have my fingerprint. That's $60 a month that I didn't know I had to pay. I have the best Medicare that exists. I've had it for 40 years. What the is going on?
Call the business administrator of Summit Medical at that practice. Call them, Toby.
And tell them.
How do I find out where they are?
Call their office and tell them you want to talk to the business administrator and you will call them and tell them that you are not in a position to pay that copay, and they can write that off. You're a senior?
That's not
Fine.
right. That's not right.
That's not right.
Okay, Toby, you good?
Yes, thank you.
Good.
If anyone needs anything, you could call me or Dawn. Shirley and John have my phone number, and the rabbi has my phone number, and Lisa and the.
And we're in the book. We're in
Yeah, you're
the
in the book.
And
Yeah.
we know where to find you.
And I was happy to do a little sponsoring or a little gift at the beautiful party they had for you. I know Carol or, some of the other people were at the party. We could not attend, but someone from Shomrei won my our little 1 hour consultation. So I'm talking to them this week about their parents. So that's exciting for me.
So let me bring this to a close. Wendy and Dawn, I know you both have had your really hard times, and for you to give your time to us today is so appreciated. So let's applaud them. Yay!
In all fairness, I jumped on this at the 9th hour or the 11th hour, whatever it is. So it's really Wendy's show today.
Well,
Thanks, Wendy.
No, it was fun to do it together, and I like to see everybody, and I miss you all.
And let me tell you, next week, we're going to the sort of other side of the age range. And for those of you who have children and grandchildren, we're going to talk about anxiety as a parent in the time of COVID.
I'm jumping on that call, Dawn.
Right? What does it mean to be good enough during this time? What does it mean to not have to be perfect? And I think for all of us, and invite your kids, for all of us, understanding that during this time, we know what to look for, and we have to learn how to manage our own anxiety.
100%.
As we try and deal with whether it's our parents or our children or our friends. So that's next week. And the person speaking is another one of our congregants, Sarah Feldman. And
great.
Yeah. So bring your friends and we'll hear Sarah. And because I'm looking at Todd,
Sandra, right?
Sandra.
No, Sarah.
I don't know who that is.
Not say you don't know her, but you'll really like her.
Great.
Okay.
I'm coming.
Yeah.
What's the date of that, Shirley?
I'm sorry.
When is that talk with the
Next Tuesday. We're just doing this Tuesday nights at Nourish.
Oh.
So next Tuesday, it's Sarah Feldman, and it's dealing with your own anxieties as you try and
navigate this new world.
That's exactly right. And then just because I'm looking at Todd there, June 2nd, Todd is going to speak. He doesn't know what his topic is.
Yeah.
The title promised me, but I'm calling it Planning for a Future Beyond Corona.
Oh, wow, that's a good title.
It's a good title. So thank you all. And anyway, doing these things, it's really good for your mental health.
Yeah.
So come back in a week. And we'll
Thank
see
you.
Thank you, everyone.
Thank you.
Wendy, Dawn.
Bye. Thank you, everyone. Thank you, Wendy. Thank you.
Thank
Thank
you.
you, guys.
Thank you, John.
Bye.
Thank you.
Thank you, Shirley.
Thank you.
everybody.
Thank you.
Next week is 26. It's very helpful.